Let me say good afternoon to everyone, and thank you for being here today. I'm with Councilmember Pollard, Chief Aceveda, Assistant Chief McLeod, Dr. Purse. So look, we'll start out today with today's numbers, followed by a discussion of the city's second rental relief package that the City Council passed earlier today. Today, the Houston Health Department is reporting 709 new cases of COVID-19, bringing Houston's total now to 52,320. So that's 709 new positive cases. Sadly, we are adding 14 to the list of those who have died as a result of COVID-19. That's bringing the city's total number to 503. And the 14 newly reported deaths includes a white male in his 50s with no reported underlying health conditions. And you can see that the virus continues to take a toll on the Hispanic community, with half of the deaths being reported today affecting Hispanic Houstonians. So you can see the list before you. Again, these are people who've lost their lives as a result of this virus, and their families have been permanently impacted. We still have community spread in Houston, and we want to see these numbers decline. Our positivity rate is about 15% now, Dr. Purse? It's still at 17%, but the goal is to bring that positivity rate down to 5% or below by the end of this month. So remember, we are better together, and by that we must continue to practice all the safety protocols together, and that still means wearing a mask, social distancing, washing your hands, and getting tested. And getting tested is the best way to empower yourself and protect your family and the community. Let me emphasize the importance of getting tested. I know you've heard a whole lot about that over the last 5 months. And then in July, we kind of reached our peak in the numbers of people going to the various testing sites. And then the numbers now have started to decline in the last couple of weeks. Let me encourage you, please. Take the time, go and get tested. You can show up now at the Houston public sites. You don't have to register. You can simply go. This is not the time to become lax, okay? I know you've heard quite a bit about being tested, but that is a critical element in getting managing this virus. So again, let me encourage you to please go and get tested. And I'm going to add, if you got tested, for example, a month ago, a lot has happened in the last 30 days, and so you need to go get tested again. For myself, for example, I've gotten tested several times, as recently as Saturday of this past week. Thank goodness things went well, negative. But again, please go and get tested, okay? So don't think you got tested one time, and let's say you got tested 2 or 3 months ago and you think you're good. That's not the case. If you got tested a month ago, don't assume you're good. So it's free, doesn't cost you anything. You don't have to register. Go to the public testing sites and get tested. Today, City Council passed a second rental relief package in the amount of $20 million. I want to thank the members of City Council for their unanimous support of the program. The amount includes $15 million from the Coronavirus Aid Relief and Economic Security, the CARES Act, also known as the CARES Act, and $5 million from generous donors who understand the impact of COVID-19 that is having on our working families. Let me also say to the people in the city of Houston, corporations, businesses, that you can still give. The total is $20 million. 5 of that comes from people from the private donors. Houston Endowment, the Greater Houston Community Foundation Relief Fund, Janice McNair of the Texans, Janice McNair, the Kinder Foundation. They make up that $5 million. They've got a few more calls out, but there's a tremendous need in our city. And so let me encourage you, please, if you will contribute all of we're using Baker Ripley, the nonprofit, to administer the program, so the dollars don't come to the city. They go to Baker Ripley for the Houston Recovery Relief Fund. And things are different this time around. For example, the funds will be committed based on a vulnerability prioritization, not first come, first served. And so long as the funding is available, those who meet the higher prioritization criteria will be able to move to the front of the line. What that simply means, we're taking a look at the lowest, who's paying the lowest amount, for example, on the rent, and then we work up. Because if you're at that lower level and you're not able to pay, pretty much the only place left is to the streets. So we want to make sure that people don't find themselves on the streets. Then a part of the deal that the landlords and who are participating in this program, they have agreed to waive all late fees and interest for that month. We allow for interest penalty-free payment plan for any rent due in excess of $2,112. The landlords are agreeing to refrain from initiating eviction process or rescind any prior eviction process. They agreed to a payment plan for any balance beyond that amount of $2,112. They agreed to refrain from evictions through September of 2020. And they agreed to enter into a payment agreement with all tenants of property under the following conditions, which means that if just one tenant at a particular apartment complex receives the cash rental assistance program, none of the tenants at that apartment complex will be evicted through September of this year. So we've done our best to leverage this $20 million, and I hope that number will grow. And I want to thank the Houston Apartment Association and others for working with us to assist people at a very vulnerable time as we all work to deal with COVID-19. So to qualify for the rental assistance, the person must live in the city of Houston and be behind on rent payments for August or prior months and cannot pay the rent due to economic challenges specifically caused by COVID-19. Even if only one tenant in an apartment complex qualifies for rental assistance, the no eviction rule applies to all tenants on the property, and we also ask the landlords to waive the late fees and interest as I've indicated. I want to stress that this is no perfect formula. There is no perfect plan, and we know there are Houstonians with a lot of needs as a result of the pandemic, and that is why I'm urging Congress to put more money for rent relief in the Second CARES Act package, and I'm calling on our state leadership to address the needs of Texans. Cities, as I've said before, cities cannot do it alone, and we are trying our best, but we should not be the only resource looking out for families in terms of rental assistance. So again, I want to thank the council members for their support, for their advocacy, and for working with the administration in getting this done. Now let me pause and let me bring up Dr. Peirce.
Thank you, Mayor. Today I want to talk a little bit about the decline that we've seen in the testing at our large sites in particular. We've seen this graph before, and we've seen there's been a dramatic decline. One of the things that I had said previously that I was concerned about was whether or not people had been hearing that we'd had some good news coming out of the hospital sector and that may have influenced them. And so what I've gone back and done is cross-reference, if you will, the dates when the data from the hospital started to improve and when our numbers at the testing sites started to decline, and in fact, they line up pretty good. So you can see that on this chart, that declined on the bottom, it's in small print, but there's July 12th is indicated, which is about 2 or 3 days before the decline begins. And it turns out that the hospitals peaked on around July the 10th. So after a couple of days of the decline, people started noticing that, talking about it, give it a couple more days, and then it appears that the numbers of folks going to get tested started dropping off. I confirmed this with our colleagues. I spoke with Dr. Umair Shah, the Executive Director and Health Authority for Harris County, and at their sites they saw the exact same thing. Their decline started just a couple of days after ours, but it has been nearly as dramatic as our drop-off. So my fear is that people have misinterpreted a little bit of good news into thinking that it's a lot of good news. And so I want to remind folks that if we as a community are going to stop this virus, which we can do, we've done it before, we can do it again, we have to get ahead of the virus. And testing is really important for you and your family to get ahead of the virus. Remember, we've been saying all along that the person you're most likely to infect or the person you're most likely to be infected by is a family member. So if you want to protect your family, go and get tested. You should get tested If you think you have been exposed to someone who has got the virus, if you heard that somebody at work or some friend of yours or some other acquaintance of yours tested positive, you're afraid that you may have become infected, don't wait until you get symptoms necessarily, but you can go ahead and get tested. Now, recognizing that you can get a false negative, sometimes you test too early, so if you develop symptoms, go get tested again. But if you think that you have been exposed and you get tested and it comes back positive, you are now empowered to isolate yourself and tell the rest of your family members to quarantine. And that's how we as a neighborhood, as we as a family, as we as individuals can stop the virus. And this is why being tested is so important. We've also said that today, our number of folks who are come back positive is still 17% as of last Friday. That is a huge number, and it is, quite honestly, it is more than the health department's contact tracing team can keep up with. So we really need for people, every one of us in the viewing audience here, to pay attention. If you think you've been exposed, and especially if you think you have symptoms, if you think you have symptoms and you're really sick, you should reach out to your healthcare provider. But if you think you have symptoms that are mild and you don't want to call out to your healthcare provider, you can go and get tested. And if the test is positive, you are now empowered. No longer is the virus empowered to mess up what you're doing and to allow you to inadvertently infect family members. So you now become empowered. So let's talk about getting tested. On this screen, you can see that there are many, many testing sites across the Houston area. These are all free testing sites, every one of those. If you want to find out how to get a hold of one, you can go to HoustonEmergency.org/COVID-19, or you can call the number on the screen, 832-393-4220. They will give you all the instructions, all the information you need, the hours, the specific address, whatever you need, they will have that information for you so you can go ahead and get yourself tested. And that's a great way to get started. And then the last thing I want to talk about is with the contact tracing. Should your test come positive, when we get that information, we will reach out to you to help inform you with what you can do to protect yourself and your family and your coworkers. And you will hear from us through one of these three ways. It's either the caller ID should say Houston Health, or it may say 713-853-8700, but it should say Houston Health. If you gave us your email address, you may hear from Houston Health Department at qualtricssurvey.com, or you may hear from us through a text message if you request to be reached out that way. And the text message will come from 35134, 73940, or 39242. And this is how we're reaching out and getting in touch with people to empower you to stop the virus in your family and at your place of work.
Look, let me say it's better to know than not to know, okay? So don't assume, well, I'm not going to be, I don't want to know. Better to know than not to know, okay? So please take advantage and get tested. If you lost your taste, sense of taste, or dry cough and all of those type of things, but even if you're feeling great, fine, better to be tested. Otherwise, you can be walking around and infecting other people. In addition to that, that's why it's important to wear this mask. Put the mask on. Cover your nose and your mouth. And because the numbers are still too high, positivity rate at 17%, we want to drive that down to 5%. That's why we're taking the next step, and that is if you're out in public and you're around other people and you don't have on your mask, you will get an initial warning, but after that, you will get a ticket, and that is $250 ticket. So, it just makes good sense to put on the mask and avoid that. Okay, you don't have on the mask, you're out in the public, you're around other people, you get the warning, and then the next step you're going to do, what's going to happen is that you're going to get that ticket. Let me call on the person who is the author of making that happen. Don't want to give you a ticket, but if we have to give you a ticket, Chief Acevedo, just smile at him as he comes, because he got the citation pad.
Thank you, Mayor. Thank you for having us. I just want to give a quick update on our COVID numbers for the police department as of today, and then I'll talk about the citation posture. As of today, we have a total of 163 of our employees that are in quarantine, 138 classified, 25 civilians, 82 positive on the classified, with 56 pending in terms of the results of their tests. 18 civilians are positive with 7 pending, And you know, Mayor, we've had two deaths of our support staffs year to date. Year to date, we've had 447 members of our department that have tested positive for COVID. And like the mayor said, testing is not necessarily about how you're feeling. Testing is about identifying whether or not you're someone that can make somebody very sick by spreading this virus. And ultimately, testing is about trying to save lives and the lives of your family members, your friends, your neighbors, your colleagues, and ultimately all of us here as first responders. Our friends at the fire department have lost 2 of their frontline firefighters, and again, we continue to lift them up in prayer, and especially with the latest one that will be buried on Sunday. As it relates to our enforcement posture, we're getting a lot of media requests, Mayor, as you are, on how many citations we've written. Since the mayor's order, which I believe you issued on Friday, you changed the enforcement posture, Mayor, I believe it was, Monday, the tickets get entered by the court system, so that sometimes takes days, if not a week or longer, to enter them. So what I have directed my staff to do, I just issued right before I came over here our order where we have created an actual coding for enforcement, and we will start tracking starting tomorrow. Any time in our records management system, anytime we issue a warning for failure to wear the mask, and anytime we issue a citation. So we'll have more of a 24-hour picture, Mayor, that we can provide to you in the community. Let me just say this. We are not interested in writing tickets. We don't want to write tickets. Mayor Turner doesn't want us to write tickets. What we're interested in is saving lives. What we're interested in is getting this community, this state, this nation, and ultimately the free world and civilized world past COVID-19 so our kids can get back into the classroom where they belong, so our economy can get back to where it needs to be. But ultimately, our number one goal is for people to just simply do the right thing, and please wear the mask. Police officers, we have so much to deal with, but we know that death is final, whether it's in a traffic crash, at the end of a handgun, or at the hands of a deadly virus. It does not discriminate, but sadly continues to disproportionately impact the African American and Latino community. We know that those are the 2 largest ethnic groups in this city. And if I may, Mayor, real quickly in Spanish, a la comunidad hispana quiero decirle de nuevo que desgraciadamente este virus sigue matando la comunidad latina hispana en números mucho más altos que cualquier otra comunidad y la comunidad afroamericana. Les suplicamos que por favor póngase su máscara y acuérdese que empezando el lunes el alcalde nos dio la orden que vamos a empezar a meter multas, darle multas a la comunidad. La multa es $250 y eso es mucho dinero y no queremos que tenga que pagar esa multa. Hasta ahorita no tenemos ninguna información en cuántas multas hemos dado, pero pensando mañana vamos a empezar en nuestro sistema de records, vamos a empezar a todos los días saber cuántas personas han tenido advertencia de los oficiales y cuántas multas hemos dado. Por el fin del día lo que queremos hacer, lo que el alcalde Turner quiere hacer es salvar vidas. Y no podemos salvar vidas, lo mejor que podemos hacer para salvar vidas es ponernos nuestra máscara y hacerle caso a los oficiales, a los médicos, a los científicos, que lo dicen que con las máscaras estamos en buena condición. Así que, por favor, no queremos dar multa. Nuestros oficiales no quieren dar multa. Por el fin del día no vamos a respetar la ley, no vamos a respetar a nuestros vecinos, a nuestros familiares, a nuestros colegas, sí le vamos a dar multa. Así que, por favor, vamos a tener vamos a ganar la seguridad que necesitamos de salud. Pónganse la máscara. Gracias. Thank you, Mayor.
And Chief McLeod, I believe Firefighter Bachanko's funeral is Saturday. You wonder? Chief McLeod.
So the arrangements for firefighter Pacheco, we have a Friday night private vigil for family and friends only. On Saturday, the firefighter march will kick off at 10 a.m. Near First Baptist Church off of Katy Freeway, followed by the service at 11. The interment will be private also at a different location.
And Councilmember Pollard, if you will emphasize the importance of landlords participating in the program, especially coming out of your district, since I think your district probably has more apartment complexes than almost any other.
Thank you, Mayor. Yes, I represent District J. over 85% of our residents live in apartment complexes, so I know firsthand how important this rent relief program is. I want to highlight that one of the main differences between this rent relief program and the one we did previously is that landlords who participate in this fund, not only will they have to agree to not evict the individual tenant that is applying and receiving the funds, but for any eligible tenant that is at the entire complex. And that's going to go through September 20th. And so when we're thinking about a grace period ordinance or a 60-day grace period, well, this is quasi that, because any landlord that participates has to contractually agree not to evict anyone that is eligible for a COVID-related outstanding rent payment through September 20th. And so that's very important. We're able to leverage so many more of the dollars by doing that. And so it's not just going to be for the individual, but it'll be for the entire complex. Again, when we think about COVID and the coronavirus, this is extremely important because it keeps people in their homes. If not for this, people would have to start doubling up in other people's residences, and they would not be able to socially distance, which would hurt the community spread. So this is a great effort. I'm glad to see it done. And thank you to City Council for approving today. Thank you, Mayor.
And if I'm not mistaken, the last time we did the rental relief program, and if I'm not mistaken, there were about 3,700 apartments that participated in that program, about 3,700 within the city of Houston. So a lot of people can benefit from the program that was passed today.